Okay, so this is the last part, part 11, just getting into the learning objectives, going over those, and upcoming assignments. Going back to our case with Mildred, how can we treat her shoulder fracture through the early and later stages of healing? What ultrasound settings will you use? I just talked about this. She's fractured her shoulder early on, let's say. She just comes into the clinic right off the bat, 3 or 4 weeks post. You're thinking healing. Healing with ultrasound. You think healing, you think low intensity, pulsed mode. So the mode is pulsed, and the intensity is low. So intensity probably like 0.1, and you do like a pulsed mode, say like 20%, 8 to 10 minutes over her humeral head, followed by maybe some passive range of motion. Early, if you go to that treatment box, you can figure out what you're going to do early and late. Early on, just some general things you could try, not a complete list. You could do pendulums. Always, in doubt, do pendulums, especially early on. Do one-handed dressing techniques, hemi-dressing techniques for her non-affected side. She'll have to get dressed with one hand and do her ADLs with one hand. So teach her a lot of that. Get all the non-affected joints moving right off the bat. Her good shoulder, and especially on her affected shoulder, keeping her elbow and hand active with range of motion, some exercises. You could try some supine, passive range of motion, maybe some tabletop stuff, education around the sling. And then later stages, wall climbs are great, pulley exercises, active assistive range of motion. Think of the wand exercises, moving into more linear diagonal planes and resistive exercises, getting back into doing the things that are important to her. Okay, the learning objectives, going over those. How would you treat a one-part non-displaced shoulder fracture through early and late stages? Just did that one. How would you define the neuromatrix theory? This is around pain. A good definition for neuromatrix: pain is genetically determined and modified by the environment. Pain is genetically determined and modified by the environment. Comes right from the PowerPoint slide. What two things can ultrasound generally accomplish? It can heat tissue up so you can stretch it, or it can heal it. It's in acute healing stages. What are two ultrasound contraindications? There's multiple ones, but two of them. Don't do it over growth plates, a young child over the growth plates. Don't do it with somebody with cancer, active cancer, pacemakers, a few others. What ultrasound settings would you consider for heating up the tissue? Again, just talked about that. Heating up, high intensity, 1.0 to 2.0, and continuous modes, it's on all the time. What ultrasound settings would you consider for healing the tissue? Low intensity, 0.1 to 0.5, and pulsed, on and off, on and off. 4 general parameters for ultrasound. We've talked a lot about this. Research is definitely there, but it's not totally convincing on the evidence. It's not spotty in places, but it does what it does. A key thing for the ultrasound to think about when you're deciding whether or not to use it, it goes a lot deeper than heat and ice. It gets a lot deeper into the tissue. So if you're trying to get, like, say, that humeral head deep under the deltoid, or the supraspinatus deep under the trapezius, sorry. So the supraspinatus deep under the trapezius, ultrasound would be good. All right, and then this is the student-led coming up. We're adding shoulder anatomy along with the scapula anatomy, and then coming up for our lab. Before that lab on 9/16, you want to get this PowerPoint done so you know what we're going to be doing and why we're doing it. And then that quiz, coming in the quiz will be on the shoulder and scapula anatomy, week 3 in lab quiz. And it'll have the week 2, not this week's, but the week before lecture questions. There'll be probably 1 lecture questions off that. And you could be called for the student-led demonstration, which again includes the screening and the shoulder and the scapula anatomy. And that is all that.